Namaste everyone. I'm Harini from Team Yatartha Bodha of SBEBA. Today we have Dr. Shanthan sir, who has been practicing SBEBA for the past 4 years in Hyderabad. So welcome sir. Uh, Sir, no, we are very eager to know like how your journey started with SBEBA.
So, being a student of Ayurveda, my UG days, I have started exploring what all is happening around the fraternity of Ayurveda. In that way, I came across something called as SBEBA in Facebook, Science-Based, Evidence-Based Ayurveda. By the time Ramya ma'am was actively sharing many posts on Facebook, and she was looking totally different from what others are sharing. So that sort of provoked thought in me that what exactly this SBEBA is. So she was frequently pointing various mistakes happening in the contemporary Ayurvedic practices and education system. So looking at that, I was very curious to understand what exactly is SBEBA. So to know what exactly it is, I happened to attend the SBEBA CME, Bharat Mission Bishop, in 2019. And from then, I can say the way I see Ayurveda has changed totally. And it's been 4 years that I'm practicing SBEBA.
Okay. Sir, how was your practice before SBBA and how your practice got transformed, after being associated with SBBA?
Yeah, so I started my practice in 2013, I can say. When I was in my BMS itself, I have started my practice. Initially in the families and later on treating the patients outside. As you know, it always happens the same way everywhere. You just follow your seniors or any legends you have locally. So whatever prescriptions the faculties or anyone outside does, we just copy the same thing. Sometimes we just try to copy the drugs or anything from the literature we have around, the samhitas or some ready-made manuals we have in the market. We just try to match this disease, that medicine, and we blindly prescribe that to the patient. There is absolutely no attempt in understanding the clinical situation and understanding the complexities involved in treating a case. But once I started SBEBA, I can say that I have stopped my practice for 1 year completely, because it was a shock for me to learn that what all education we have been getting in the colleges is totally wrong. So exact Ayurvedic education, it is not being given properly anywhere. So it took almost 1 year for me to unlearn and relearn everything. And only after that, I can say the precision in clinical practice has increased by unparalleled level. I mean, I can say that the practice before SBV and after SBV, they can't even compare it at all. It is totally different.
Sir, can you share with us like some of the difficult cases which you tackled through SBBA? Just an example.
Yeah, many would be surprised, but my first SBBA case was a case of acute angina. So it was a case of myocardial infarction, which was about it, onset already happened, and then the patient happened to contact me. It was during COVID time. The only thing we could do was to get an ECG and the cardiac markers done. Evolving MI was seen in the report. So looking at the training I got in SBEBA, and I was keen to take up the case. I was sure that it's going to help the patient. And with our pioneer, Dr. Rajkumar sir's guidance, the case was treated successfully within 24 to 48 hours itself. So this is something unimaginable for a beginner in those days. So when you treat a case of acute evolving MI using Ayurveda with such a precision outcome, so that is something which is going to show a very big impact on your thought process and your clinical practice as well. So I can say that the cases which SBBA physicians deal are not as simple as contemporary Ayurveda, because in the regular practice there are patients of acute appendicitis which can land into acute abdomen at any time. There are cardiac emergencies. So we often deal acute emergencies which conventional Ayurvedic practitioners cannot do many number of times. So that is the biggest thing which keeps SBA apart from the conventional medicine.
Thank you so much, sir, for sharing your experience with us. And also, there is an upcoming CME which is happening for the first time in Pondicherry on 14th and 15th of October on the
Yes.
topic common respiratory pathologies in practice. Would you like to say some words about that, sir?
So only one thing I would say. First of all, I would like to congratulate the team of Bharat Mission Bishop Puducherry for conducting this CME. This is going to be the 51st CME of SBBA Bharat Mission Bishop series. all the students and all the practitioners who want to totally transform their practice and do actual justice to the patients using the science of Ayurveda, I can say SBEBA CMA series is the only way to understand and practice the precision Ayurveda as it is. So I urge all the students, especially because students are unbiased most of the times. When they go in the right path, the further road they proceed in the coming years would be a very easier way for them. Many people usually they get exposed to many things, they have to unlearn and relearn again. But when a fresher students in the UG level itself, they start attending the CMA series, it will be quite easier for them to be on the same lines and they can do much more better in the coming days.
Thank you so much, sir. After seeing your interview, I hope many more students and practitioners in Ayurveda will get, motivated and join us in the CME. Thank you so
Hopefully.
much, sir.
Thank you. Thank you.
Thank you.